Today we're going to talk about something really important. A skill that could, no joke, one day save the life of someone you care about. We're going to learn how to spot a real medical emergency. So let's dive right in.
You know that feeling, right? Your kid has a fever, or maybe a parent just isn't feeling right, and you're stuck wondering, is this just a 24-hour bug, or is this something I need to rush to the hospital for? That anxiety is completely normal, but the way to handle it isn't to panic, is to know what to look for. And that's where this idea of health vigilance comes in. It's not about trying to be a doctor, not at all. It's just about being an attentive, watchful person. It's about developing the skill to notice the signals that are screaming for immediate help.
Okay, so let's start at the very beginning of life. Little babies can't just tell us what's wrong, right? So their bodies have to do all the talking. Our job is to learn how to understand their nonverbal language.
Think about it. A healthy baby is a hungry baby. So if an infant suddenly just refuses to eat, that's a huge red flag. Another major sign is lethargy. If they're just super sleepy, almost floppy, and you can't really wake them up properly, that's serious. Also, you gotta watch for dehydration. Like, are they crying with no tears? Is their mouth dry? And finally, persistent vomiting. Vomiting that just doesn't stop. These are all clear calls for help.
Now look closely at this image. This is a huge one. It's called chest indrawing. If you ever see a baby's chest and the skin between or below their ribs getting sucked in every single time they take a breath, it means they are fighting for air. That is a true get help now emergency. And here's another critical sign you can actually see. You know that soft spot on the top of a baby's head? It's called the fontanelle. It should be soft and relatively flat. If you see it bulging outward like a little hill, that can be a sign of dangerous pressure building up inside the skull. You don't wait on that. You get medical help right away.
Okay, let's move on up to childhood. Now, as kids get older, they can tell you a bit more about what's wrong. But the signals we need to watch for are just as urgent, they're just a little different.
For young children, the key is often about a combination of symptoms. Look, a fever by itself is super common, but a high fever plus confusion or extreme lethargy, that's a whole different ballgame. Same with breathing. If they're having trouble and it seems to be getting worse and worse, that's an emergency. And of course, any kind of severe or long-lasting seizure is an immediate red flag.
Every single kid gets a stomachache at some point. But this is different. We're talking about severe pain, the kind where they can't get comfortable. And if you notice their belly seems really hard or swollen, and they're also vomiting, that could be something like appendicitis, and you absolutely can't wait on it.
The teenage years, man, they bring a whole new set of health issues, and a lot of them can pop up really suddenly, so you've got to be just as vigilant.
Here's the most important rule for this age group, and it's actually pretty simple. For teenagers, any pain that comes out of nowhere and is incredibly severe should be treated as an emergency. It's the body's loudest possible alarm bell. We have to listen.
So for teenage girls, this could look like a sudden, sharp, terrible pain in their lower abdomen or pelvis. This isn't just bad cramps. This could be a sign of something serious, like a ruptured ovarian cyst or even an ovary twisting on itself. You don't wait and see with that kind of pain. And for boys, there's a direct equivalent. Sudden, awful pain in the scrotum or groin area. This could be what's called a testicular torsion, where things get twisted and blood supply gets cut off. With this one, every single minute literally counts to prevent permanent damage. And it's not just about pain, right? Suddenly not being able to breathe or having severe chest pain is obviously an emergency. Same goes for fainting or collapsing for no reason. And this is so important, we have to treat mental health crises with the exact same urgency. If a teen is showing extreme behavioral changes or talking about suicide, that is a medical emergency, period.
All right, let's talk about adults. These signs are some of the most common reasons people end up in the emergency room, and they are absolutely critical for all of us to recognize.
When you suspect a stroke, the saying is, time is brain, and it's true. Just remember these three things. 1. Sudden weakness, especially if it's just on one side of the body or if one side of the face starts to droop. 2. Slurred speech or talking nonsense. And 3. Sudden confusion, not knowing where they are. If you see any of these, call for help immediately.
Okay, here are 4 other big ones for adults. First, any new or worsening chest pain or shortness of breath. Could be a heart attack. Second, suddenly having trouble walking or keeping your balance. Third, anytime someone just collapses or faints. And finally, and this is a big one, especially for older adults, any sudden new confusion or big change in their mental state is a major sign that something is medically wrong.
So, wow, we've covered a lot, all the way from infancy to adulthood. After hearing all these serious signals, what is the one thing I really want you to walk away with?
It's this. This whole thing isn't about making you more anxious. It's the opposite. It's about trading that vague, constant worry for a focused, smart awareness. It's about learning to tune out the noise and listen for the signals that truly matter.
You can think of these signs as the clearest possible message a body can send when it's in real trouble. It's a direct request for help. Seeing this signal is the first step, but it's taking that next step, acting on it. That's the part that really saves lives.
So now you know what to look for. You've seen the red flags. The only question left is, when you see one of these signs, in yourself or in someone you love, are you going to trust it? Are you going to have the confidence to say, no, this is real, and act without hesitation? Because knowing is only half the battle. Acting is everything.